Good morning. Thank you for joining us for Lakewood's panel discussion of coronavirus or COVID-19. We do want to let everyone know, all of our viewers, that we are not experts on this topic. However, all of these panelists, as well as all of Lakewood staff, is very committed to keeping our residents and our staff members as safe as possible. I'm going to go through and introduce our panelists here in a moment. And we also have questions that have been submitted throughout the weekend to our Lakewood staff. Please know that we are continuing to monitor the WHO and the CDC website, and we encourage all of you to do the same. We will be having regular updates as things change, because momentarily, or at a moment, different information changes and we have to review and retrench our guidance. But let's go ahead and get started with some introductions. We have Mr. Barrett Way, our Executive Director. We have Dr. Khalid Kareem, Medical Director. Michelle Ellen, Nurse Navigator and Director of Clinic. Eileen Quack is our Assisted Living Administrator. In the back row, we have Mr. Frank Simmel, our Facilities and Environmental Services Director. Myra Conway is our Infection Preventionist. Sally Sansucci is our Director of Resident Services, and Ms. Beth Ferris is our Director of Human Resources. I'm going to start with Barrett Way to start with some remarks that he might have. And for our audience who is viewing us, you will see that all of our panelists are following recommendations for spacing between to the extent possible, and we do have to share some microphones, so they are doing cleaning and infection control of those microphones. Barrett?
Thank you, Felicity. It's, as Felicity touched on, we're trying to do everything we can to stay up to date on everything that's happening here at the campus. The guidelines are changing every single day. And so what we're committed to do is making sure that we're communicating as much as possible of those changes, and then we're going to continue to every single day try to provide more and more updates because as we're getting the information, it's changing every single day. But Felicity asked me to be on the panel to talk about some of the dining changes that we're witnessing. And so from a dining standpoint, we get a lot of questions because food is so important to our residents and making sure that we're providing nutritious meals to our residents. Last month, we served about 28,000 meals, so we serve a lot of meals every single month. And with the new guidelines of restricting communal dining, it puts a lot of pressure on our dining team to produce meals, but also to deliver meals. And so every meal going forward today until the end of this virus, we're going to be delivering all meals. And so healthcare, assisted living, those areas have had delivery services in the past when a resident maybe is feeling ill and needs to have a sick tray delivered to that individual. But for independent living, in the past, we've done about 40 deliveries at an evening time. But now we're going to deliver every single meal to every single apartment. So that's a lot of meals to deliver. So our team is starting that today. And so for lunch coming up in the next hour or so, meals will be going to every single apartment. The menu choices, they're going to be more limited. The focus right now is providing a nutritious meal. In the past, when there's not a virus concern, we have a huge variety of meal options, wonderful meals to pick from. During this crisis moment, we really are going to have just very limited choices. The goal is to provide nutritious meals, get them to the apartments so you can enjoy nice lunch, dinner, breakfast. But that's really the focus right now. Our community, we do have emergency food supplies. We're going to be delivering meals. We'll provide some dining updates. So there's going to be a lot of changes going forward, but the number one change today is meals will be delivered going forward. All right, thank you for listening.
Thank you, Barrett. Dr. Kareem?
Good morning, everybody. I know you guys have gotten a lot of information about the virus. I just wanted today just to talk about why all this is necessary, because a lot of people have expressed to me that they are not really sure what this is really necessary, this isolation and all these restrictions that have been put on in the community, and also especially in the in the retirement communities, and especially the places where we have a lot of elderly in assisted living, the nursing homes, where people are not even allowed to visit. So I'll just give you a little bit of background so that people would understand why it is so important and necessary, and also to know where we're going from here, because it may get worse when it comes to the isolation and all, because that's the only tool we have left now. So I've been, over this last week, I'm not an infectious disease specialist or epidemiologist, but I've been reading a lot on that, all the recent articles from all over the world, what's happening in the world, and how this virus originated and how it's spreading and where it's going. So I'll just give you some, whatever I have read. This is all scientific research. This is not based on any news or anything that our politicians or people are saying. So what happened with this virus is, this virus started in China, as you know, in a province called Hubei. Wuhan is the city in Hubei. So it caused havoc there, and then it spread from outside of China. It could have been contained there when they found out, but it was too late by the time they realized it had already leaked out of China. So with the viruses, these kind of epidemics, it's a pandemic actually now. The best case scenario is when you can contain it. You can isolate it and eradicate it. But unfortunately, so far there's been only one country it's in 148 countries now. I think it's 148. There's only one country that has been able to isolate and eradicate it, and which surprisingly, that's the country which used to be part of China, is Taiwan. Taiwan is the only country who had, what they did was they started doing the testing from the first case. When they found out, they became very aggressive in testing. So you can get an idea how many tests they did, that for each positive case, they did 113 tests to find one case. That's how they isolated their cases. They were close to 50. They isolated them, contained them, and that's how they prevented the spread of infection. All other countries, it has gone beyond that. So the only thing we can do now is to contain the virus, to mitigate the damage it's going to do. I'm sure you have heard a lot about the bending of the curve, or straightening of the curve. I would like to just give you some idea what that's about and why it's important. I'll give you an example of, when there's a lot of unknown about something, we need to go back and look in the history. And if you read the history in 1918, when we had the Spanish flu, it was the same kind of panic, and the same way it started, and people did not know much about it. So different places, different cities treated it differently. So I was reading about it in Philadelphia in 1918. They treated it very lightly, like some people do it now, and they poo-pooed the whole thing, and they had a big parade going on. They did not cancel it. While in St. Louis, Missouri, they took it very seriously, and they put all the restrictions and put the way we are doing now, actually more stricter than right now that we are doing. They did even more, had more stringent measures. So what happened was, when all, it's not like they didn't get infection. St. Louis also got the same number of infections like Philadelphia did, but Philadelphia's death rate was 250 per 100,000. And guess what? St. Louis was less than 50. I'm giving you this example to help you understand why this isolation is important, and what is the flattening of the curve, and what does it do. So what happens is, if you don't control it, infection is going to spread either way, whether you do contact isolation or not. But what happens is, if you don't isolate, if you don't do the social isolation, do not slow the speed with which the virus travels, what you get is you get a curve that goes straight up. And what it does is it overwhelms the healthcare system. And then under the normal circumstances, the people who usually go to a hospital, get treated, get well, do not get treatment, and that's how they die. And look at what happened in China. In Hubei province, it's the same country, and some people will say China is hiding the numbers so we cannot trust them, we don't know what they're saying, what they're reporting, but in the same country. In Hubei province, they had death rate of 8%, but rest of the China, they have only 0.8%. What's the difference? The difference is in Hubei, they didn't have time to put all those restrictions. But once they found out what was going on, in rest of the China, they put the whole country in lockdown. That's how they controlled it. That's why the death rate was similar to the normal flu death rate. And same thing is happening in Italy. Italy's death rate is right now 10%, while in South Korea it's only 0.5%. What's the difference? Is it a different virus? No, it's the same virus. The only difference is Italians they took it lightly. They did not put any restriction. They went their way, they went to their restaurants, to their parties, and what happened was the virus grew and the healthcare system got overwhelmed. People who needed to go to ICUs and to go on ventilators did not have them. They did not have the healthcare system to deal with them because they got overwhelmed, and that's how the people died. The same people would not have died if they would have slowed the spread, because then the healthcare system could have easily coped with that. That's why it's so important for us to take it seriously and make sure that we follow the instructions that we are given to us. Otherwise, what will happen is what's happening in Italy is there will be a mandatory lockdown. I see it coming. And what I'm reading is very scary, especially if we don't do our part and follow these instructions and this contact isolation very seriously. This can create the same kind of havoc that it's doing right now in Italy. Now we're going towards Spain, and then France, and then it's coming towards us. So we got to take it very seriously. All of us have this responsibility, especially our young people. Our parents and grandparents have always done sacrifices for us, but now it's our responsibility to make sure that we do some sacrifice for our parents and grandparents, and take this thing seriously and try to avoid other people as much as possible. I mean, you would not hear from it. I never thought I would say to one of my patients, but I was calling my patient and telling them, do not come and see me. Don't go and see your doctor if it's not absolutely necessary. Because we're trying to isolate this virus from spreading from people to people. That's the only tool we have got right now. So please take it seriously and try to understand why it's so important to have this isolation as much as possible. Thank you.
Thank you, Dr. Green. You mentioned something that I think is vitally important, worth pointing out even more, as you said 3 words: do our part. And that is really what all of the panelists are going to be focusing on, what they are doing within each of their departments, but it is also very, very important that the residents here on campus in all levels of care do their part to keep everyone healthy. Michelle Allen's going to speak next.
Hi, I'm going to go over some of the precautions that we can take to help contain the spread of the virus, as well as go over signs and symptoms, things that you can do if you are showing signs and symptoms of the flu or the coronavirus. Some of the things that we can do every day are wash our hands often, 20 seconds with friction, wipe down surfaces, disinfect the frequently touched areas, avoid touching your face, nose, mouth, eyes, avoid crowds, avoid all non-essential travel. If you are not able to wash your hands, use the hand sanitizer that contains at least 60% alcohol base. If you have a cough, cover your mouth either in your elbow or a tissue and immediately dispose of that tissue after each use. Wear a mask if you're sick. And so if you're showing signs and symptoms of a virus, the CDC is recommending if the if the symptoms are mild, to isolate in your apartment, to avoid spreading it throughout our community. If you always want to be looking for, if the symptoms are increasing, getting worse, things such as difficulty breathing, shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips, face, things like that would need medical attention immediately. We would ask that you contact your medical provider. You can still use your SARA pendant to notify concierge, and a nurse will come over to assess in your apartment. Some of the main symptoms to watch for are fever, cough, and shortness of breath. Those are the typical symptoms with this virus. As far as the clinic, we are closing the Lakewood clinic to independent residents, staff. If you are showing symptoms or if you have any other emergency medical need, we will go through using your SARA pendant or contacting the clinic, and a nurse will come to your apartment to assess and go from there. Even though we are closing, all the staff are still at the clinic to be there to answer questions and to assess needs. And some of the other things that you can do should the isolation become to where you're not going out into the community, you need to make sure that you're having enough of your medications on hand. So if you're able to, get a surplus of those in your home, I would recommend doing that. Just having those basic staples for food in your apartment, drinking lots of liquids to help prevent dehydration. So those are some of the things that you can do to prepare for should we not be able to leave our campus. If you're needing groceries, I know that Publix, you can order online and they can deliver. We are discouraging going off the campus, highly discouraging that to help prevent bringing the virus onto our campus here. So those are some of the things that we're doing as the clinic and as the Lakewood community to help prevent the spread. So.
Michelle, just to reiterate, you said that you and your staff will go over to assess a resident if they have any type of medical concerns versus them coming to see you.
That is correct.
Okay.
So you will just call the clinic or contact concierge, use your SARA pendant. However, we will be here to go and assess.
Okay. Thank you. Eileen Quack is going to speak next.
So Lakewood has been preparing since basically this whole outbreak began in January sometime to increase our PAR levels of essential medical supplies. And we continue to have the necessary items needed to care for assisted living and healthcare residents, day-to-day needs, as well as if we were to have an outbreak of illness on the campus, whether it's flu or corona. But the medical suppliers are allocating supplies to the hospitals and facilities like ours. And our deliveries now are being very controlled, and we're getting shipments, very controlled shipments. So, because there are shortages of supplies across the United States, so we are just working with them, trying to stay a step ahead. We have no cases of coronavirus in assisted living. Actually, I don't think it's been said, but we don't have corona anywhere on our campus. No confirmed resident or staff with corona. So as to date, we've done a good job of keeping it out, and that's our goal is to continue that. We have done a big switch of our cleaning products being used by the CNAs and the nurses on the units. We're using a product that is more effective in killing the coronavirus, and it will continue to be used on the units. As of today at lunch, we will begin serving lunch meals, all meals, in the residents' rooms. In assisted living and healthcare, they are able to continue to walk on the unit. So if they're a first floor resident, they're able to walk on the first floor. Second floor resident, they're able to walk on the second floor. And that will continue until, unless something changes. No visitors are permitted until the guidance has been upgraded. So we are not permitting access by anyone, residents, family, volunteers. It's mainly medical personnel and essential personnel into healthcare and assisted living. We have granted exceptions to a couple of residents, family members who are sadly going through end-of-life care. Their families will be screened, they'll don the proper PPE and be escorted to that residence space. So we ask that all independent living residents, if you think that you can come through the healthcare doors, those doors will be locked, and you will no longer be able to access. If you need to pass off something, you can let the screener know, they'll get it to the concierge. If I'm talking about supplies, food, laundry, things like that, it's gonna have to be a pass-off process until further notice. Staff will be providing one-on-one activities and interaction, as well as offering and assisting and reaching out to loved ones via telephone or FaceTime or Skype. We have the ability to do that, but it's everything changes so quickly. These are all new directives that began this weekend, so we've got to get the meal thing down, and then we will start going to residents and trying to offer that service. And assisted living residents have been informed to stay on the units until the guidance changes, and this will continue to be reinforced. That's all I have about assisted living.
Thank you. And I want to point out about the guidance that Eileen is referring to is actually coming to us from CMS, which is the Centers for Medicare and Medicaid Services, which is who mandates and regulates our healthcare center. And then, of course, as I indicated at the beginning, our focus is on residents in all levels of care. So we feel as though that is best practice, and the guidance from CMS then is impacting residents in all levels of care. So not just one panelist or not just one person made the decision to limit all visitors, but that is a collective decision based upon federal government and what is best for our residents. So again, to reiterate, only at end of life, not just because a resident is on hospice, but if somebody is actively passing is when we are working with those families to grant access to the residents. Otherwise, any visitors, independent residents coming to visit a spouse in assisted living or healthcare are impacted by this. I'm going to turn it over to Beth Ferris to speak next.
Good morning. So everything that we have in place has been in place for a while with our employees. We want to keep our employees just as safe as the residents. So some protocols that we've been doing, we're just going to continue to do, but beef it up a little bit. For example, if they do call off sick, we have always asked if they could share some information. Or do you have anything communicable? Do you have a diagnosis? Do they need to shut down a hall? Is it something that's rampant? So we will continue to ask those questions, not to pry, but it's just kind of a side effect of working in healthcare. So if an employee has an illness like the flu or a cold, they're still to follow the protocol that they've been following. They should be symptom-free for 48 hours before returning to work or finishing their antibiotic or whatever the illness is. If they've been diagnosed with the coronavirus, we are asking that they stay off for 14 days in self-quarantine. The cutoff for people that are already here is 100 degrees. I believe that's still the same. So if they have a fever of 100 degrees or higher, they will be sent home. The employees are being screened at all the entrances as well as residents too. So that's in effect with the employees. We've had our staff developer here over the weekend. Lori Chisholm has been doing education, infection prevention. She's been doing hand washing demonstrations and answering a lot of questions, donning and doffing their personal protective equipment, things that we've always done, but just to make sure that the employees know that how important this is now and to continue to practice those safe habits. If an employee is going on vacation and travels to a high-risk area, we are also asking that when they come home from vacation that they stay home, again, self-quarantine for 14 days. So if they're out of the country or going on a cruise or any high-risk area, maybe even in the United States, depending on it, they should still stay home for 14 days after, just to remain symptom-free and keep it out of the campus. We are doing online applications only. We have a website and Indeed and Monster and other software that you can do your application online rather than coming in and filling out a paper application. That has always been encouraged, but we're going to do that now. If we do need to interview, because we still want to staff the building, we do have a room reserved in the clinic, a patient room that's going to be sterile and wiped down after each interview. So we will continue our hiring practices. The staff dining is closed. Salad bar is gone, so we won't be sharing that space anymore. And then last, our healthcare, if you take our healthcare through Anthem, they have always covered preventive stuff at 100%. So we have been informed that Anthem will actually do the coronavirus testing and cover that at 100%. Now I know there might be an issue whether testing kits are available, but just know that Anthem is still going to do that, and anyone covered on our medical plan, it will be covered at 100%. That's all I have. Thank you.
Thank you, Beth. We're going to take a quick break and we will return in just a moment. We are back. Thank you, Beth. She concluded with discussing about how important it is to still have staff members working here while maintaining their safety and making sure that they're not bringing in any germs or anything that might negatively impact our residents. So we're going to turn over to Sally Sansucci to speak next.
Thank you. I want to acknowledge this is a very trying time for all of us. Lakewood's resident services team, and in fact the entire Lakewood community, has taken several measures to protect our residents from exposure to this virus. We thank you for your patience as we work through as Felicity and Eileen both mentioned, really rapidly changing guidance that we are getting. Because it is changing so quickly, it is a little bit of a challenge to try to keep up-to-date information in front of our residents, but we are changing our touchdown communications immediately as we receive new guidance, and we are distributing daily memos to residents with any new information. Lakewood transportation to medical appointments is canceled except for medically essential treatments. Medically essential treatments include chemotherapy, radiation, and dialysis. Any other exception would have to be approved by our healthcare administration. Our vehicles, if we do take those trips, our vehicles will be completely sanitized after the trip, and the returning resident must be screened at one of our screening entry points before returning to their apartment. All organized group activities have been canceled at Lakewood. We will be streaming religious programming and entertainment on Channel 972 frequently, and a schedule will be distributed for that later this week. As of this morning, the shuttle service and the wellness center are now closed. Independent residents have not been restricted from visiting one another or leaving campus at this time. However, we strongly urge you to remain in your apartment and to limit the risk of exposure to coronavirus. You're not only taking a risk for yourself, you are putting our campus at risk when you return. We strongly urge all residents to discontinue trips off campus except for medical emergencies. We are working with Lakewood's food vendor and with our local Publix to bring some groceries to campus from you. We contracted with them early last week to make sure this was possible with Publix, early last week to make sure this was possible, and it is. We do not have the details of that program in place, but I want to assure our residents that you will be able to get your groceries delivered from Publix as long as we are permitted to do so per the guidelines that we are being given. And we will get that information to you within the next 48 hours. I had some questions that I don't think have been addressed so far by the panel that were directed to me, so I wanted to just answer those very quickly. One question I had was, will someone take care of my pet if I become ill? All residents who have a pet should have a friend or neighbor designated as an emergency contact, someone to take care of your pet if you become ill, so please make sure you have that in place. Another question, can I still go to the library to shelve books? We strongly urge you to remain in your apartment and avoid public spaces. The virus lives on surfaces, so even if you're alone in that public space, you could be risking exposure. And the last question that I don't think has been addressed yet today, can I drive off campus? We strongly urge you not to leave campus. If you do, please report to one of our screening areas before you return to your apartment, regardless of what residential building you live in. Thank you.
Thank you, Sally. Beauty shop and bank are closed as well.
The beauty shop is closed, and the bank, if it has not closed, is about to close.
In the fitness center, Miles.
The wellness center is closed as of this morning. That's the pool, the hot tub, and the exercise equipment. Miles is available to come to resident apartments for one-on-one, as our physical therapy department is doing. And we will be streaming some exercise classes on channel 972.
Okay, thank you.
Thank you, Sally. As you heard from Sally, there's several updates these are today, tomorrow, yesterday, very time sensitive. And so one thing that, since we are speaking to 3 different populations, speak to independent living, assisted living, and the healthcare center, one thing that we're going to start to make sure there's constant communication, because you're hearing things today that are changing, that are different than you heard last week, different than yesterday. You'll probably hear some updates tomorrow that are going to be different than today. Starting tomorrow at 9:30, we're going to be utilizing this streaming capacity a lot. And we're very fortunate here at Lakewood to have the capacity to be able to stream to every apartment, especially in this situation where we're asking residents to stay in their apartments as much as possible. But to be able to have this level of communication is really unique for our campus, so we want to make sure we utilize the capabilities fully. So starting tomorrow at 9:30, myself, Eileen Quack, and Felicity Wood will give updates, and those it could be a 10-minute, 15-minute update, but it's just an opportunity to share what's happening today, any questions that we received the day before we'll go over, but it's every day at 9:30, so as you wake up and you're eating your breakfast, we'd love for you to just turn your TV on, just hear what's happening that day, and know that if you have any questions, you can submit those, you can email them, and then we will the next day give any updates, because there will be changes, and then answer any of those questions that you have. So we're just committed to have a constant conversation, but we want to use our technology to facilitate that conversation, as opposed to having in-person meetings, which we've been accustomed to.
Thank you, Barrett. That's going to be an excellent resource for residents to stay up to date, because as every panelist has spoken about, everything is changing so rapidly. We want to make sure residents understand and are receiving that communication. We're going to turn it over to Myra Conway to speak next.
Good morning. I would like to talk about our infection prevention. We have infection prevention in place for quite a while now. What infection prevention is, the implementation and surveillance of standard operating procedures for all tasks and or work areas having potential for exposure. So the biggest thing here is to wash your hands, and wash your hands for 20 seconds, or use the sanitizer as Michelle had mentioned earlier. We also here in healthcare, we have a lot of education provided by Lori Chisholm, who will provide all kinds of education, not only to our staff, but to the residents as well, especially for personal protective equipment, which involves the mask, the gloves, and the gowns, which we all have in place here in healthcare. Now, throughout the facility, we will do surveillance and monitor all residents here. If there's any fever or any of the signs that may be causing you to have some type of respiratory issues. Again, we would like to inform and express how important it is to hand hygiene, to wash your hands, not to handshake with anyone, not to hug anyone, to keep your distance for now. We're very fortunate here also at Lakewood to have private rooms, especially in our AL and in their healthcare. Our staff is well versed with infection prevention. Again, we will be doing all types of monitoring and surveillance just to make sure that we keep you posted if there's any infections.
Thank you, Myra. Can you speak a little bit just to mask usage? You had mentioned the education and servicing that's going on for the staff on the use of PPE. How are masks being used here at Lakewood?
Well, we are here at Lakewood are using masks for, the staff's using masks to go into any isolation room. So quarantine is isolation. So the staff will be wearing a mask, a gown, and gloves going into isolation. They've been trained how to put the PPEs on, which is your personal protective equipment, and then how to take it off, again, to wash your hands. As far as residents going out, they probably could be wearing a mask, but here in healthcare, we're very, like I said again, monitoring and doing surveillance on all residents and staff for any type of infections that could cause maybe the coronavirus. Right now, we have plenty of supplies with all the equipment for now. As Eileen said, everything's being monitored.
Thank you, Myra. We'll turn it over to Frank Sybil to speak.
Thank you. I'm just going to go over some of the things that are happening as far as the housekeeping and maintenance departments go. Supply-wise, the supplies we use, we did over-order supplies to prepare for this. Our stocks are in good shape right now. The supplies that we do have and that we use on a daily basis, we have checked the CDC website. They have a list of all approved products for killing coronavirus. We have matched all ours to their list, so everything we use does kill the coronavirus. I'm not going to get into specific products, but if you need to know what those are, you can see me separately. Because every product has different instructions as far as contact times and killing the virus, we have performed in-services with all our housekeeping staff to make sure that they are aware how to use that product to make sure that it is killing the virus. What we are doing with staff that has extra time and housekeeping staff in general, we are sending them to every building, regardless of level of care. So that's healthcare, AL, independent living. They are going through the entire building and disinfecting all common surfaces. Some of those include doorknobs, elevators, handrails, chair rails, mailboxes, pretty much everything that someone would touch while entering or leaving the building. They are hitting those. We are trying to hit those multiple times per day. And that's every single building, not just healthcare. I have received a few emails with some concerns about people entering residents' apartments. We have decided, we do bi-weekly housekeeping here. We have decided we will give you the option to suspend those services in case you don't want anybody coming into your apartment. So all you have to do is call the concierge and let them know that you want to suspend your bi-weekly housekeeping services. And again, with maintenance is typically a called-in work order. Just if it's something minor, just don't call in the work order until after this is passed, or email me personally and we can make some kind of arrangement. Last thing I want to touch on is contractors. We do have a lot of contractors that work at this site. We have suspended work by all contractors that work inside any building. The only contractor that we would allow on the property is someone like landscaping who does not enter the building at all. But every other contractor, whether it's unit turns or anything else we may have getting done, has been suspended until further notice. So we are basically trying to limit any kind of outside contact that may bring this virus into our property. That's about all I have.
Okay, thank you, Frank. I was going to ask you about the contractors, but you beat me to it, so thank you. I'm going to start asking the panelists some questions now. Let's start with Michelle Ellen. One of the questions that came in from independent residents and their families is, what if I utilize private duty in my independent living apartment, or a companion, someone who comes in and does personal care for me? Is that going to be allowed?
Yes, that will be allowed. What we are asking, if you are using any outside agency to come into your apartment, that they first come to the healthcare entrance so that they can be screened prior to going to your apartment. As far as those residents that are utilizing the in-home companion care program through the clinic, we will still be providing assistance in your apartment.
Very good. Thank you, Michelle. Eileen, can you speak a little bit more to the drop-off and pickup service that's going to happen for residents in the higher levels of care?
Sure. In assisted living, we do have some family members who prefer to pick up resident laundry and take it home and wash it and bring it back. And we still can continue that, but it will be, it'll have to be brought to the concierge, bagged before bringing it to the concierge, and then it will get picked up by the family at the concierge, and then reverse that system when the laundry is done. You could bring it back to the concierge desk, staff will ensure that it gets back up to the unit. If you don't prefer to do that, we do have washers and dryers on the unit, and the staff can continue to do the laundry like they do for many assisted living residents right on the unit. And for healthcare, it would be the similar process, except with healthcare, the laundry goes to the main laundry. So if you are a healthcare family member or spouse and you like taking that laundry home to do it, it would have to be brought down, arranged to be brought down to the concierge. You could pick it up and bring it back and return it, or just allow Lakewood to take over that task for you during this time.
Thank you, and that'll apply also for, I know that some family members will bring over a newspaper after they've already read it to share with their loved one.
Same thing. Somebody brought over a pair of slippers the other day. I guess they had washed them. And we ask that you have it in a bag. It can be a trash style bag with a name and a room number on it. And the concierge also has a supply of bags there to do that as well. Just make sure it's clearly marked, and we will get it where it needs to go during this time.
Thank you. Dr. Crane, we have heard that the virus will stay on surfaces for 12 hours. Is that correct, or can you speak a little bit more to that so we are aware of cleaning in our homes?
So, I mean, what I have read is based on the research that I've done recently. the virus, it stays in the air. After somebody coughs, it stays in the air for 3 hours. Then it drops to the floor or other surfaces. And then dependent on the surfaces, there's a different duration. The shortest period it can stay is on copper, where it can stay up to 4 hours. But on cardboard, it stays for up to 24 hours. On the plastic and stainless steel, it can last up to 3 hours. And on the clothes, it can last even longer, up to a week. That's what I've read so far about it. So you can make your decision based on what kind of material you're cleaning.
Okay. And I'm assuming, Dr. Kareem, you recommend everyone who is able and willing to get onto the CDC website, or who, are there other resources that they should be using?
I think CDC is your best resource, so that way, you can get the scientific research, not the different kind of opinions you're hearing from different people based on their, where they stand on the political, or their, whatever their, background is. It's best to follow the guidelines for the CDC. And if you listen to the news, I would recommend listening to Dr. Fauci very seriously, because he's the one I have found that he gives the right information most of the time.
I'm sorry.
Anthony Fauci,
Okay.
the CDC, he is the one who is always, I have found, but he usually goes with what I'm reading in the medical journals and in the research what I'm reading.
Okay, thank you. Beth, this is a human resources question. We are still in flu season, so if a staff member divulges to their supervisor that they've been out to the doctor, what is Lakewood requiring of those staff members as far as documentation, and how long are you out for flu versus how long are you out for COVID-19?
Okay, we've always had in our policy that we have a right to ask for a doctor's note, because we are very careful. So if someone's out sick and they're out for a day or so, in the past, if they've been out for 3 days, we've asked for a doctor's note just to make sure that they're allowed to come back to work, so they can come back, no restrictions. So we can still ask for a doctor's note anytime. And I think I mentioned that if it's been diagnosed with the flu, then you would go through the process of getting over the flu and be symptom-free for 48 hours, as opposed to the coronavirus, where you need to be out for 14 days.
Okay, thank you for that clarification.
You're welcome.
Frank, can you speak a little bit to the work that was going to go on here in the clubhouse with noise mitigation? And I know you did mention about the contractors, but there were specific questions regarding that work. Can you just give us a statement again?
So we did have a large project for sound mitigation that was supposed to start today. It was an 11-week project, impacted almost every resident in the clubhouse. Due to the nature of this virus and the amount of people that would have been in and out, deliveries coming into the property, a decision was made to cancel that project at this moment. There is no date right now that has been set for it to restart, but it's basically being postponed until we feel that it is safe, again, for a large amount of contractors to be running through the building and in individual apartments, and a mass amount of deliveries coming to this project. There are more details that our corporate office had worked out with individual residents. They would have to contact them for any of those kind of details. But we will, once we do decide when we will restart that project, we will let all those residents know.
Okay, thank you. Eileen, regarding level of care transfers, is that type of work still going to be happening here? And while we're waiting for that, I will go ahead and answer one of the questions that was posed to us regarding the whether therapy is still going to be functioning with residents or not. Rehab Care has provided their own guidance to their therapist, as well as Lakewood. And in independent living, assisted living, and in healthcare, the therapist will be traveling to the resident. So if you're an independent living, they'll be coming to your cottage, villa, hybrid apartment. They will be coming to the residents' rooms in assisted living and in healthcare, and the therapist will be providing therapy right there in the home. Some residents have already opted at the independent living level to discontinue therapy for the foreseeable future. That is your option. However, rehab care is doing all necessary steps to mitigate the virus. They are screening their staff members because we are screening them. So they are checking for that, and we are still having therapy happen. It's just happening in the residence of the individual. Eileen, you want to speak to level of care transfers?
Sure. Sure. I am still waiting for some guidance this morning, since there were some changes over the weekend with visitors from the corporate clinical director about how we're going to handle in-house transfers. Say we have a resident in healthcare who's going to come do a temporary transitional stay in assisted living. Something like that will be relatively easy with our current restrictions because it will be the staff doing the moving, and we don't really need to have family involvement. It gets a little more complicated if somebody is doing a permanent transfer from independent living to assisted living, that we will run into some problems because that takes usually family assistance and needing the family here to help make some decisions on what's coming, what's staying. So that's something we'll probably talk about tomorrow morning when we get together again. But right now we're trying to look out for the best interests of the residents. And if that's what needs to happen to get them to a level of care that they need to be in, that's our preference. We want people to be safe. So this is still a work in progress.
Okay, thank you. Sally, can you speak a little bit to the question of what about Lakewood residents who are going out of the country or traveling to a high-risk area? What are we going to do when they return back here to their home?
Sure. The recommendation, of course, is that they not go. But if an independent resident chooses to go on a trip to a high-risk area and is allowed to do so by our government, when they come back, they will be asked to self-quarantine for 14 days in their apartment.
Okay, thank you. Sally, also, the question has come up between residents going between apartments and kind of getting together, of course, because we're limiting interaction. There is also the concern of the opposite end happening, which would then be isolation. So what are we encouraging residents to do?
Again, anytime there's contact, we have a risk. So the less contact residents have, the better, but there is no prohibiting of residents getting together at this time. My recommendation is we take advantage of the beautiful weather and do that outdoors, so you're at least minimizing the exposure to public surface areas.
Okay, thank you. A question came up that I will go ahead and answer regarding skilled admissions coming in, and actually this is one of those areas that we have just received very recent guidance on that. So effective as of now, and of course this could change momentarily, but we are still allowing skilled admissions to come from the hospital into our healthcare center. However, those admissions will be screened prior to acceptance by our admissions team, as well as our medical director, Dr. Kareem, and our director of nursing, Anne Marie Neville. Those two individuals will need to review their medical, the background and information from those prospective admissions, and approve that they are okay to be accepted. Further, when those individuals are actually admitted into Lakewood, they will be screened utilizing the CDC screening tools that we have implemented, and they will also be quarantined for 14 days. Other questions or comments that the panel would like to provide to the residents tuning in? I'll turn it over to Barrett.
I just had I've heard a couple questions about staffing levels, and right now I can say that we're adequately staffed. We've got a great staffing level right now, and as we've canceled activities, transportation, certain programs and functions that we've always done. As we've stopped those services, we've reallocated some of that staff to doing some of the tasks that you're hearing from the panel. So right now, we're at a great staffing level. Should the virus spread and impact the staff going forward, that's something that we're constantly monitoring, and we'll just keep the residents up to date on what we're doing to combat that. But right now, we're at a great staffing level, and we've hired some outside healthcare professionals that are doing the actual screening at the doors. So those are those individuals that you see as you're walking into the campus. But we're great staff right now, and we'll keep you updated as we move forward.
Thank you, Barrett. We're going to take a real quick break. We have one final question that we are going to ask of Dr. Kareem, and that is, how long is this going to last? All of these guidelines, restrictions, how long are they going to be implemented here at Lakewood?
I wish I knew for sure, but the best case scenario is that by summertime, hopefully it dies down. Our main goal is to slow it down so we can keep up with it with our healthcare system can keep up with it so we can save people who get infected by it. But right now what they're saying is the hope is that it will die down by summertime. But nobody knows for sure though. If anybody tells you they know for sure, then they are not telling you the truth.
Thank you, Dr. Kareem. Obviously, we are in a global pandemic, and that is why Lakewood is working so hard to keep its residents and staff members safe. So please, to reiterate what Dr. Kareem said earlier, do your part. Please keep your neighbors, in addition to yourself, safe. Stay home, stay out of the hallways, stay out of visitation with others, stay home, implement the different strategies that we have spoken about today, and above all, just stay safe. Thank you everyone for your time, for joining us, and we look forward to connecting with you tomorrow morning at 9:30.